Did you know that unfortunately, living a healthy lifestyle, having a great diet, exercising regularly, those things do not prevent egg cells from aging. And they do not prevent a reduction in our ability to conceive as we reach our later 30s and 40s. Many times I've spoken with patients when I was working at an IVF clinic or talking to patients about the genetic testing on their embryos. And patients often believed that because they were healthier than other people in their age group, because they ate really well, because they exercised, that they were going to have no problem conceiving in their 30s or 40s. And that is simply not always the case. We know that regardless of how well we eat in our lifestyle, avoiding smoking, not drinking much, it is still a guarantee that our egg cells are going to age with us, and that it is very likely going to be harder to conceive as we approach our later 30s and 40s than it is in our 20s. As people with egg cells age, the number of eggs we recruit for ovulation each month, it reduces. It's reduced. And the number of eggs that can go on to result in a genetically typical embryo and then ongoing pregnancy, that also reduces regardless of our lifestyle factors. This is why for many people, egg freezing can be a fantastic option. Over the past 10 years or almost 10 years that I've worked in assisted reproductive technology, I've seen a huge increase in the number of people who are pursuing egg freezing. And I've also seen a huge increase in the number of insurance companies that are covering a portion of or all of an egg freeze cycle, which is amazing. Hi, I'm Katie Lee Hornberger, a certified genetic counselor who practices in the space of assisted reproductive technology, and today I'm talking all about egg freezing, why you might want to consider it, when to consider it, how it works, how many eggs you might want to freeze, how much it costs. Those are the things I'll be covering today. Now, I just mentioned that a lot of insurance companies have started covering some egg freezing costs, and I think it's important to know that the cost for an egg freezing cycle can vary significantly depending on the clinic you choose and where in the country you might be seen. In general, I'd say in the US, I often see that egg freezing or embryo freezing costs range from about $15,000 to $25,000 per cycle, though you can certainly find clinics that can do it for a less expensive cost. Even prior to consulting with the clinic to get information regarding the cost for an egg freezing cycle at that specific location, you could always consider calling your insurance company or looking into your benefits to get an idea of whether you have any coverage for egg freezing. Egg or embryo freezing can be done for a multitude of reasons. For some people, it can help them delay building a family. Perhaps they don't want to have children until a couple of years or more than a couple of years from now. Egg freezing has the potential to help people build their desired family, have a higher chance of having the number of children they hope to have, or to delay starting a family until later years. It can also be used for medical reasons. Egg freezing can be used for individuals who have been diagnosed with cancer and need to undergo cancer treatment, which may reduce their chance for naturally conceiving or increase their chances for needing IVF, in vitro fertilization, in the future. It can also be done for reasons like endometriosis or for patients who have a genetic condition that might reduce their chances to be able to conceive naturally. If you are interested in egg freezing or creating embryos for any of those reasons or other reasons, a great place to start is by doing a little bit of research online, locating clinics that look like good fits near you, and scheduling an initial consult to talk about egg freezing with a reproductive endocrinologist. Let's talk about the logistics of egg freezing or oocyte cryopreservation. What exactly is it? Well, egg cells are extracted from the patient's body in a surgical procedure, a short one. They're frozen or cryopreserved, very rapidly frozen, and they're saved or stored for future use to later be fertilized, or they can even be fertilized before they're stored if an individual already has their partner or the sperm source that they know that they want to use. Otherwise, they can be thawed out, fertilized in the future, and then utilized for an embryo transfer to hopefully have an ongoing pregnancy. This allows people the opportunity to hopefully preserve their fertility and offers them the chance to conceive later using eggs that were created or retrieved at a younger age. And that's going to give most people a much better chance for success than creating eggs at a later age, just because as we age, our chances of having genetically normal eggs, and a good number of them, it reduces. Now let's talk a little bit more in detail about the process. Usually one of the first steps will be meeting with a fertility specialist, and those are reproductive endocrinologists. The egg provider will undergo a series of tests. This is going to include blood tests and ultrasounds to evaluate the patient's ovarian reserve to help get an idea of how successful is an egg freezing cycle going to be for this patient. What should they know? And to give some expectations to the patient as to how likely is it that we're going to get a decent number of eggs, and what does it mean to have that number of eggs in terms of chances for having a live-born baby in the future. Once the blood work and ultrasound results are back, Your doctor will be able to better understand the quantity and quality of your eggs to help guide your treatment and expectations. And then you and your doctor will work together to determine the best time for your egg freezing cycle. Or maybe if they're recommending multiple cycles, how many cycles they might be recommending and when those might happen. When you're ready to get started, your clinic will provide you with a calendar and medication dosing for your stimulation. Ovarian stimulation typically includes a combination of oral medications and injectable medications. And the goal of ovarian stimulation is to stimulate the growth of all of the eggs in your ovaries. Instead of in a typical cycle where you're not undergoing ovarian stimulation, during a typical menstrual cycle, with ovulation, just one egg becomes mature. With ovarian stimulation, the goal is to have multiple eggs reach maturity, as opposed to in a natural menstrual cycle for most individuals in any given month, just one egg is going to reach maturity, and the remaining eggs they essentially die off. During the stimulation process, the patient's going to be monitored, so that means they're going to come in for regular visits, maybe about every other day or every 2 days or so, to have some blood work and ultrasounds done to see how many follicles are growing. During this monitoring process, your doctor will keep an eye on how stimulation is going, and eventually they'll say you're ready to schedule a retrieval. The retrieval is an outpatient procedure, so it's typically performed under anesthesia. It's really quick. It usually only takes 10 to 15 minutes most. During this procedure, the doctor will insert a thin needle which will go through the vaginal wall and into the ovaries to collect the eggs. Before you go home, you're typically alerted to the number of eggs that can be frozen or can potentially be fertilized, and you'll let that anesthesia wear off for a little bit of time, maybe 45 minutes, an hour, and then you're on your way home. Meanwhile, your eggs are quickly flash frozen or vitrified, and then the eggs will be stored in storage tanks. They'll be cryopreserved to thaw and use later. The truth about all things fertility is that there is never a guarantee. This is also true with an egg freezing cycle. Hopefully, during counseling prior to your egg freezing cycle, your clinical team should be educating you on the chances that your eggs will go on to result in a healthy live birth. They should be counseling you on how many eggs they might expect based on your fertility evaluation and then based on your monitoring throughout your cycle. They should be counseling you on possible side effects from the medications that are required for ovarian stimulation and any risks associated with the egg retrieval and the freezing process. Egg freezing is a pretty cool opportunity in that it offers a lot of flexibility for family building and can offer a lot of peace of mind. If you found this video helpful, please subscribe, please like it, give me a comment down below about what you'd like to hear from next, and thank you so much for watching. I'll see you next time.